We were veering into talking about one person versus two person psychology, which initially came about through the article you sent me about a particular almost DID, dissociative identity disorder patient that was being treated by a trauma therapist who ultimately found that working in this so-called two-person model was more effective in helping him.
It's an interesting, somewhat complex topic, so I'll do my best. The one-person psychology is to see the problem within the patient, so it's a more symptom-based approach. This person has anxiety. What's going on with their anxiety? In a purely biological model of treatment, you might give them a medication, but in a more traditional psychotherapy based on understanding, you would try to get them in touch with the material within themselves that they can't access. Feelings that are frightening to them, emotions, urges, impulses. So in the article you referenced, this was a young man who'd had horrible trauma, was a child soldier at the age of 8. A rebel army invaded his village, killed his parents in front of him, took him away, forced him to fight, to kill, to rape, all the things involved in that kind of warfare. And it, from the perspective of the therapist who wrote the article, led to aspects of his internal emotional world that were terrifying. Violence, aggression, that he couldn't sort of come to terms with that. So the more traditional one-person psychology would be to say, what is it that you're not in touch with? Is it that you're having this symptom because you're afraid of that part of you? And that tends to be a little bit intellectualized. You're talking about things almost hypothetically. Could it be that there's a terror in you you can't access? Well, if you can't access it, you can't access it. So that's where the two-person psychology comes in. And it's fascinating and challenging. Aspects of the patient's internal world, aspects of their deep emotional self, become activated in the therapist. That's what we call countertransference. There's a splitting off of that part of the patient, so he is not aware of it. It's too scary and painful to be in touch with. And in this particular case, as the patient spoke in the therapy sessions, the therapist was filled with all kinds of emotions of anxiety, terror, and her ability to sit with that, metabolize that, taking it from its raw state and being able to capture it with words, symbols, images, fantasies that are acceptable to conscious thinking as opposed to being separate from conscious thinking. So the therapist was the carrier of the part of the patient he could not tolerate, and her ability to get in touch with that, understand it as it was evoked in her, and gradually help the patient get to know it, led him to be able to integrate those split off parts of himself that could not be integrated if he were just looked at as a specimen to be studied. The whole inner experience had to be played out between the two of them.
Is your sense from the article that he was doing things in the sessions that were almost threatening to her sense of safety, and she was sitting there and letting him come at her, and instead of her like running away and recoiling, she sat and absorbed it, and it allowed him to, what did it do for him?
Well, first of all, just so viewers know that therapy isn't a free-for-all, we do have to have parameters, limits of what's okay. The patient can't be violent in a therapy session. A patient can raise his voice, but if the patient starts yelling and expressing himself so that it would interfere with my colleagues in the adjoining offices, I'd have to say, please, tone it down a little bit. But the challenge is to create a safe space for those emotions to be experienced. And there were ways that the patient spoke to the therapist, perhaps innuendos, perhaps nonverbal communications that created that sense of terror and fear in the therapist that she had the confidence to be able to sit with rather than recoil from. And that ability of the therapist to hold the emotions that the patient cannot be in touch with because it's too overwhelming allows the patient to gradually get in touch with them.
In terms of a one-person versus two-person process of treating someone, is there a way for people who are, say, watching this channel to sort of assess what kind of model they're in and if a two-person model would be a better fit?
You mean in life or in therapy?
Oh, well, that's a good question too. I guess the two-person model functions as a model for what happens eventually in life. Is that right?
Yes.
Is that what you're implying?
Yeah. So I want to make a kind of a general statement. It sounds probably bizarre to a lot of people, and it might even sound like it's some kind of mystical belief, but we do think that individuals do have the capacity to elicit in others emotions that are actually part of the first person, but the first person doesn't want to have anything to do with. That's the two-person model. And I would say we all do that to some extent, but the level to which we do that varies according to the degree of personality pathology we have. The more personality pathology you have, the more you're not acknowledging part of the contents of yourself, your mind, and eliciting them and seeing them in others. So I would recommend to people to always, when you're interacting with somebody, just try to picture yourself from their perspective. Try to take yourself out of your perspective and say, how might they be experiencing this interaction? So that's just a little rule of thumb that could be helpful to people in their day-to-day lives. If this process happens and it's not understood, others, not just therapists, but going back to your question, other people in the life of the individual can be left carrying a burden of painful emotion that's not their own. I don't know of any quick way to escape from this or to get a perspective on this, except what we're talking about now, which is to understand the process and wonder about it when you're feeling an emotion that's very intense, very troublesome, and maybe to begin to reflect on how that emotion was evoked in you and see if it's all yours or might have been provoked by the person you're interacting with.
And what if you're the one doing the injecting of yourself into someone else? You know, how do I know? Maybe I mean, I'm sure I do sometimes unconsciously put my crappy feelings into other people, and then they have to inhabit my very painful space, and then they feel in pain.
Well, they
probably don't want to be my friend or something. But
they're not. But I would say
I'm inhabiting them.
They're not inhabiting your space. You're making their space the uncomfortable space.
Invading.
You're invading.
I'm invading.
Yep. You know, I understand your question, and it's very well intentioned, but I don't think there's an easy way. I mean, sure, if somebody can take a reflective perspective and become aware of this on their own, that's great. It's hard to do because the awareness is so painful. It's extremely hard for somebody to just come to that awareness on their own. If it can happen on their own, that's wonderful. But that's why a therapist often is necessary to guide them on this path.